Hi, welcome to webcast series episode number 2, COVID-19 update. What have we learned in the past year? So we all know that we've been dealing with this for a year now. COVID-19 was declared a global pandemic in March of 2020. We've learned quite a bit of things, but there's still a lot that we need to learn. So I just want to go over today some of the things that we do know. So our objectives, again, this should be pretty quick, is the general overview of COVID-19, some statistics related to cases, death, the variants that we keep hearing about, and then of course, mitigation strategies. Here's a quick bio about me. I'm Dr. Scarlet Spain. I'm a full-time assistant professor at Valparaiso University. I am also a practicing occupational health nurse practitioner, and I'm a consultant here at MedX. So my information is at the bottom. If you have any questions or want to chat, or if we can be of service to you, please reach out to me. My email address is scarlet.spain@medxteam.com. So first we're going to talk about some basic science facts of COVID. So we know that this is a contagious virus caused by a new coronavirus that has spread throughout the world. The actual official scientific name for this is SARS-CoV-2, and we know that it may cause mild to severe illness. This specific coronavirus is a bit different than other ones that we've seen in the past because it causes large amounts of inflammation in the body. And again, we're finding out more with science and, epidemiological studies who may be impacted more, but we still have a lot to learn on that. We also know that COVID-19 has the capacity to spread very quickly. In epidemiology, we use a term called R0. And basically, that's a mathematical term that indicates how contagious an infectious disease is. It's also referred to as the reproductive number. So you'll hear this term with different infectious disease. When compared to other pandemics that we have had in the past, this is a much more contagious virus. So even the R0 for influenza is between 1 or 2. So that means somebody with influenza can potentially spread that virus to 1 to 2 people. And then with COVID-19, we can expect a positive person, so somebody with COVID-19, to spread the virus to possibly 2 to 3, maybe even 4 people on average. So that R0 is much higher, which is also a large concern, obviously. This is why we must continue mitigation strategies, and we're going to talk about that more, but now is not the time to stop masking. It's not the time to stop social distancing. All those things are still going to be of extreme importance as we are fighting this. So history of COVID-19. COVID-19 is caused by a novel coronavirus, so a new coronavirus that was first identified in Wuhan, China in late 2019. Still, the origin and source remain unknown. There's lots of theories about where this came from, but we don't know for sure. So this was declared an epidemic in mainland China in February of 2020, and it was actually declared a pandemic by the World Health Organization in March of 2020. So here's just some statistical updates as we are looking at the impact that this has had in the past year, and it's very, very significant. Total cases in the United States, over 30 million, so exactly 30,814,955. Deaths in the US, over 550,000. So this is a huge amount of deaths that have been attributed to COVID-19. Obviously, some of the reasons that we have got to use these mitigation strategies to get this under control. In vaccines administered, 179 million. So that's a great number that we've had administered. Obviously, we need to continue to amp that up and continue to administer these vaccines. So where are we now? We know that COVID-19 continues to impact our daily lives and our businesses, our places of work, our places of worship, our places where we hang out with our friends. It impacts pretty much everything that we do. Here at MedX, we are passionate about making sure that your business continues to run effectively and also safely by helping you come up with plans or staffing to help to mitigate those risks that are involved with COVID-19. Obviously, because it is a virus, it's really hard to completely eliminate it, but we definitely have a lot of plans, and we work with a lot of companies that we've been able to definitely help lower the rates and help with that mitigation strategy. So some of the things we're going to talk about today are the variants, which we keep hearing about. It's kind of a buzz term right now. What does this mean? What does this mean for us? What does this mean for the vaccines? And then mitigation strategies. So emerging variants. Viruses constantly change through mutation, and new variants of a virus are expected to occur over time. We've also seen this, unfortunately, with COVID-19. So we've noted multiple COVID-19 variants throughout the world. We've seen it in the United Kingdom, South Africa, and Brazil. So currently, multiple variants of COVID-19 are circulating globally. Several new variants emerged in the fall of 2020, most notably in the United Kingdom. A new variant of SARS-CoV-2 emerged with a large number of mutations. This variant has since been detected in numerous countries around the world, including the United States, unfortunately. This variant was reported in the US at the end of December 2020. In January of 2021, scientists in the UK reported evidence that suggests that this specific variant may be associated with an increased risk of death as compared with other variants. So this is something highly of concern. More studies are needed to confirm this finding, of course. So scientists, the CDC, are definitely looking into this. And then in South Africa, there's another variant noted, and this variant shares some mutations with the variant we just spoke about. And cases attributed to this specific variant have been detected in multiple countries outside of South Africa as well. So this variant specifically was reported in the US at the end of January 2021. We also have another variant that comes from Brazil. And this variant is interesting that it has 17 unique mutations, including 3 in the receptor binding domain of the spike protein. So this variant was detected in the US at the end of January 2021 as well. So consequences of variants. I just kind of spoke about some of the impacts the variants may have, but we know that the variants may have the ability to spread more quickly and also may cause either more mild or more severe disease. The variants may not be detected by current diagnostic testing modalities, and the variants may have decreased susceptibility to established therapeutic agents and may evade that natural or vaccine-induced immunity. So this slide just basically looks at the variants in the United States. So reported cases of the different types of variants that we've seen. And as you can see by looking at these numbers, although not astronomically high, we definitely have noted these variants here. So now we're going to talk about vaccines. So what vaccines are currently available? Currently, we have the Pfizer and the Moderna. Both are mRNA vaccines with about a 95% efficacy. Both are 2 injections. A little bit different with the Pfizer being recommended to have the second dose 21 days later and Moderna to have the second dose 28 days later. Pfizer is recommended for people 16 and older, and Moderna is recommended for people 18 and older. I do want to make note too with vaccines, always discuss with your medical team before you obtain a vaccine, and then there are just a couple contraindications to obtaining vaccines. So you can actually follow this link listed here at the bottom of the slide that will talk about the contradictions to vaccine administration for COVID-19. So what we're really looking to do with vaccines is to obtain herd immunity, which we're going to talk about. For vaccine safety, vaccines appeared to have high effectiveness in clinical trials. We've had, you saw from that number, lots and lots of Americans already vaccinated. So research and clinical trials to date have found COVID-19 vaccines to be safe and effective. Millions of Americans have received the vaccines, which are under the most intense safety monitoring in U.S. history. And the CDC does recommend you get a COVID-19 vaccine as soon as you are eligible. So herd immunity, you just heard me mention this term. Basically, herd immunity is when enough individuals have immunity against the disease to stop the spread of the disease. So many factors play into this, such as the R naught, which you heard me discuss earlier, and also the efficacy of the vaccine itself. So the new variants we're seeing are definitely presenting an issue with this as well, as we will most likely need a higher percentage based on this. So required right now, we think that we need 60% to 72% with the current vaccines. to protect most people against infection, although 80% is desirable. With this, you may see new research data come out that changes as well. So what can businesses do? And this is where we can help you. Businesses should have a preparedness plan. So preparedness plans, they're going to be pretty extensive, especially depending on what your business does, the size of it, the intricacies of it. They're all going to look a little bit different. But basically, plans should be specific to the workplace and identify all areas and job tasks specifically with potential exposure. And then response plans. So response plans are going to include what you do if you do have somebody that shows up positive with COVID-19 in the workforce. You obviously are going to need in that response plan a response to how you're going to notify, or first of all, how you're going to identify who was an exposure, how you're going to notify those people, what your business is going to do in the meantime to sustain business and keep moving, amongst other things. And then control plans. These are control measures to eliminate or reduce exposure. As I mentioned earlier, of course, with risk management or risk assessment, ultimately our goal is always going to be to eliminate exposure. However, oftentimes that is not going to be feasible, especially with a virus. So we want to mitigate or reduce exposure as much as possible. So our last slide here is guidance for businesses. So we want to actively encourage sick employees to stay home, consider conducting daily in-person or virtual health checks. We've helped many different businesses do this in its businesses that are small to large businesses. It may include temperature screening. It may include a daily questionnaire asking the employee if they have signs and symptoms of COVID-19 or if they've been in direct contact with anybody with COVID-19. And then also consider incorporating testing into workplace preparedness, response, and control plans. We're also seeing more and more businesses doing this, and we can help with this as well, and identify potential exposures. So I just want to remind everybody, again, the mitigation strategies of social distancing, masking, cleaning, washing your hands, all this stuff is still of the utmost importance. So please don't be lax in your workplace or in other places where you're visiting, because we are not out of the woods with this yet.